Leader.
86 medical beds. And at any given time over the last couple of weeks, we've been at between 90 and 100 patients in those other 86 beds.
Tonight, local hospitals push to the absolute limit with space diminishing and in some cases, no critical care or ICU beds available. Good evening, I'm Dylan Austin.
And I'm Mackenzie Henderson. Well, after hitting a grim yet predicted milestone today of actually running out of critical care beds at Blessing Hospital, tonight administrators are preparing for another.
And that would be actually running out of staff. It's a potential reality at Blessing and across the river at Hannibal Regional as well.
WGEM's Frank Healy is live in Quincy. Frank, we have information from administrators from both hospitals about this issue.
That's right. Officials here at Blessing, as well as across the river at Hannibal Regional, say that they'll probably be able to find somewhere to put you if you wind up in the hospital at either place, even though technically there's zero availability right here at Blessing right now. They say what's harder is finding staff to take care of you. Rapid testing continues in Quincy as hospital beds fill. John Simon, Adams County Emergency Management Director and EMS Chief, says they're prepared to help move people to where they need to be taken care of.
We are prepared that if we need to immediately transfer somebody out, we're talking more of a worst case scenario if there is no capacity and somebody needs a critical care bed, that we can move those.
At Blessing Hospital, doctors say that ability to move patients is now critical as their current readily available beds sit at zero. While they can add beds, they say they can't add staff. At least not at this very moment.
We have the physical space to accomplish more expansion. We do not have the staff at this time to expand any further.
Across the river at Hannibal Regional, Healthcare System President and CEO Todd Ahrens says while they do still have beds available, they're in a similar situation when it comes to staffing.
We'd be converting a lot of non-clinical areas to clinical areas to take care of patients. But right now, the thing we need most is to keep our staff, and by that I mean physicians and nurses and all the clinical folks involved, healthy.
He says that's where you come in, no matter where you are.
And to do that, one of the things we're asking the community to consider is Governor Parson and other politicians' statements about wearing masks, social distancing, washing your hands, being careful at Thanksgiving about who you're around.
Back in Illinois, Simon says the fight starts with the testing, so you know if you need to isolate.
It's our best attempt at driving down the spread here in Quincy and Adams County.
Simon says right now the goal of that rapid testing is trying to help people make the best decision about what they're doing about Thanksgiving and to prevent farther spread. Live in Quincy, Frank Healy, WGEM News.